Hello, and welcome to Module 4, Prescription Opioid Use Disorder Community Resources. Community resources can play a vital role in the well-being of communities of any size and demographic makeup. Considered assets in a community, community resources meet certain needs for the community and can consist of people, places, or structures, and community services. Community resources can be thought of as a group of services and/or assisted programs that are provided to the members of a community for free or at an affordable price with the goal of helping them become self-reliant and maintain their human rights and well-being. Community resources are assets such as businesses, public service institutions, and charitable organizations that provide assistance and services to local residents. Some community resources impact large parts of the community population, such as public libraries, churches, post offices, hospitals, community clinics, and public health organizations. Some are funded by private nonprofit groups, while others are funded by local, state, or federal government sources. Resources, both concrete and intangible, strive to meet the needs of the community by aiding and fostering ideas and solutions. I want to start off this module by introducing you to the project team responsible for the development of this toolkit. The following Montana State University faculty and staff helped create the content and graphics of this toolkit. Michelle Grokey-Dewey and Allison Brennan served as principal investigators. Michelle is the Extension Health and Wellness Specialist, and Allison is the Extension Mental Health Specialist. This team is led by Program Director and MSU Extension Associate Specialist Barbara Allen. Other MSU Extension employees responsible for the content you are about to see include myself, Jennifer Munter as Program Manager, Barbara Watson as Program Coordinator, and Lori Maurer, FCS Administrative Assistant. At the conclusion of Module 4, participants will be able to locate and better understand state, tribal, and local community agencies that provide resources for the prevention, treatment, and recovery of opioid use disorder, substance use disorder, and mental disorders. When seeking opioid use disorder or substance use disorder treatment and recovery, it's important to understand the different types of state, tribal, and community level resources that exist. Always look for facilities and service providers that are licensed and credentialed. This means the treatment provider has satisfied the necessary requirements to provide treatment. Reputable information can be arduous to narrow down, so it's best to stick with SAMHSA affiliated and licensed treatment and recovery resources and programs. State, tribal, and local resources available to individuals seeking opioid use disorder treatment can be found on the Montana Department of Public Health and Human Services Addiction and Mental Disorders Division website, and tribal resources can be located on the Indian Health Services website. This module is going to break down resources into two categories: prevention and treatment and recovery. Within these two categories, we will touch upon state and tribal resources related to opioid use disorder, substance use disorders, and mental disorders. We will begin by talking about prevention resources. Early intervention efforts can prevent or reduce the impact of substance use disorders, including opioid misuse, and mental disorders in communities across America. Prevention activities are employed to educate and support individuals and communities on the risks associated with substance use. Mental and substance use disorders are among the top conditions that cause disabilities in the United States. Because substance use and mental disorders can make daily activities difficult and impair a person's ability to work, interact with family, and fulfill other major life functions, providing prevention support and services is critical to the nation's health. Preventing mental and/or substance use disorders or co-occurring disorders and related problems is critical to behavioral and physical health in Montana. We can't always avoid prescription opioids. Sometimes they are necessary. When an opioid pain medication is needed and prescribed by a doctor, then prevention efforts can start with education on what they are, how they work, and the associated risks that come with being prescribed an opioid medication. See Module 1 for more information on what are opioids. The next step in prevention is the proper storage of prescription medications. This is key to eliminating the possibility that the medications will fall into the wrong hands, also known as diversion. Medication lock boxes are effective tools in preventing the non-medical use of opioids, as well as the accidental poisoning among children who may reside or visit the home. Another method of prevention to consider is the safe removal of unused prescription opioids from homes, which has been shown to reduce the incidence of opioid use disorders as well as prevent opioid overdoses. See Module 2 for more information on how to safely store and dispose of medications to prevent diversion, misuse, and opioid use disorder. Opioid overdose deaths are ever increasing throughout the United States. Prevention efforts to stop an overdose that is occurring is the use of a medication called naloxone. Naloxone is designed to rapidly reverse the fatal effects of an opioid overdose. Naloxone is an opioid antagonist. If you recall from Module 1, an antagonist binds to opioid receptors in the brain and can reverse or block the effects of other opioids. Naloxone can very quickly restore normal respiration to a person whose breathing has slowed or stopped as a result of overdosing with either the illegal opioid heroin or prescription opioid pain medications. There are 3 FDA-approved formulations of naloxone. The injectable formulation requires professional training and is commonly used by paramedics, emergency room doctors, and other specially trained first responders. The second formulation is an auto-injectable medication known as Evzio. This is a pre-filled auto-injection device, and depending on the state you live in, can be given by friends, family members, and others in the community. The third type of naloxone formulation is the prepackaged nasal spray known as Narcan. This is a pre-filled, needle-free device that requires no assembly and is sprayed directly into one nostril while a person is laying on their back. Again, depending on the state you live in, Narcan can be administered by friends, family members, and others in the community. Both the Narcan nasal spray and the auto-injectable Evzio are packaged in a carton containing 2 doses to allow for a repeat dosing if necessary. They are relatively easy to use and suitable for home use in emergency situations. So who can give naloxone to someone who has overdosed? Some states require a physician to prescribe naloxone, but in other states, pharmacies may distribute naloxone in an outpatient setting without bringing a prescription from a physician. For more information about the use of naloxone in Montana, visit the Montana Department of Public Health and Human Services website available on this slide. To learn more about eligible recipients of a naloxone prescription in the state of Montana, review the Montana Standing Order for Naloxone Use in Montana document that went into effect on May 1st, 2019. This link is also provided to you on the slide. There are resources available through the Addiction and Mental Disorder Division, which is a branch of the Montana Department of Health and Human Services. This division provides resources related to the prevention of both substance use disorders and mental disorders. 2 of these resources include prevention partners and prevention specialists. Prevention Partners consists of programs that specifically support and provide resources to agencies working with Montana youth. These resources include Youth Connections and a web-based system called Connect, which is designed for sending and receiving referrals with the goal of improving the referral process in our communities. Connect establishes accountability and improves the referral processes, which ultimately foster a collaborative culture among service providers in Montana. A network of prevention specialists implement evidence-based programs like Communities That Care Plus, which is a framework developed by the University of Washington that helps communities prevent problems before they develop. And these specialists also address a multitude of injury prevention topics. They have completed the SAMHSA Prevention Specialist Training, Substance Abuse Prevention Skills Training. These prevention specialists work on a regional level to support robust, well-funded community coalitions implementing evidence-based prevention activities under SAMHSA's strategic prevention framework in all of Montana's communities. Another branch of the Montana Department of Health and Human Services is the Indian Health Services Agency. This agency provides federal health services to members of federally recognized American Indian and Alaska Native tribes. The goal of Indian Health Services is to raise the health status of American Indians and Alaska Natives to the highest possible level. Located in Billings, Montana, is the Indian Health Services Office of Urban Indian Health Programs. More information is available at the link provided to you on this slide. In addition to following the Substance Abuse and Mental Health Services Administration Strategic Prevention Framework, Indian Health Services focuses on opioid abuse prevention strategies involving cultural or religious beliefs that value self-preservation, integrated behavioral health, and medication disposal. Prevention practices are typically a consideration in the creation of a tribal action plan. The Indian Health Services Agency recognizes the complexity of implementing and sustaining evidence-based strategies to improve substance use prevention, treatment, and recovery outcomes in tribal communities. The link provided to you on this slide shares technical assistance resources to support and enhance patient and community outcomes related to the opioid crisis. Technical assistance and training information such as documentation, fact sheets, and how-to guides are available on the link provided on this slide. Also accessible from this webpage are links to funding opportunities, opioid crisis data, best practices, medication-assisted recovery information, naloxone information, and more. According to the Substance Abuse and Mental Health Services Administration, opiates are present in 20% of suicide deaths in the United States. This interconnection points to the potential benefits of collaboration and coordination between opioid prevention and suicide prevention efforts, and it offers an opportunity for states to leverage the infrastructure built around the opioid response to comprehensively address suicide and overdose prevention. Depression and suicide affect people of all ages and populations. American Indian, Alaska Native populations experience a higher rate of suicide than any other group in the United States. Indian Health Services created a webpage focusing on suicide prevention. The link provided on the slide supplies information on suicide warning signs for friends and family, as well as the do's and don'ts when helping someone dealing with suicidal ideations. There is also a link to the American Foundation for Suicide Prevention with suggestions on how to find a therapist or support group and links for finding assistance. The American Foundation for Suicide Prevention provides facilitator training for support groups, which helps those who have lost a loved one to suicide to connect with others. The previous slides covered preventative resources. Now we will move forward with treatment and recovery resources at the state and tribal levels. Whether an individual is suffering from opioid use disorder, substance use disorder, or a mental disorder, resources to support treatment and recovery exist. The next few slides will highlight these resources and also provide you with resources for the treatment and recovery of substance use disorders and mental disorders through a pandemic. The most effective treatment to date for opioid use disorder is medication-assisted treatment, or MAT. MAT involves the utilization of 3 FDA medications, methadone, buprenorphine, or brand name Suboxone, and naltrexone. These medications have been clinically proven to aid in the treatment and recovery of opioid use disorder. Opioid treatment programs are outpatient programs which provide comprehensive treatment services, including the use of one of these medications, along with behavioral therapies. It is important to note that opioid treatment programs are certified and accredited by the Substance Abuse and Mental Health Service Administration, licensed to operate by the state, and registered with the U.S. Drug Enforcement Administration. A list of these licensed and certified providers can be found by visiting the link provided to you on this slide. The Substance Abuse and Mental Health Services Administration also provides buprenorphine waiver certifications to primary care physicians practicing in a general healthcare setting and not in a SAMHSA certified opioid treatment program. These types of settings are considered office-based opioid treatment facilities, and this waiver allows physicians to prescribe buprenorphine to patients with opioid use disorder that come into their offices. It is important to note that in April of 2021, the U.S. Department of Health and Human Services waived the training requirements necessary for obtaining the waiver for those providers wanting to prescribe buprenorphine as long as they did not exceed 30 patients with OUD, or opioid use disorder. These providers must still apply for the waiver, but can choose a notice of intent, which waives the training. The training is still required if the provider wishes to increase their patient load after the first year. At that 1 year mark with the training, providers can increase to up to 100 patients. And after 2 years, they can increase to 275 patients. There is one exception to the waiver requirement referred to as the 3-day rule. This exception allows practitioners who are not registered as narcotic treatment programs, meaning they are not opioid treatment providers, therefore they are not SAMHSA certified, they are not licensed by the state, nor are they registered with the DEA. This 3-day rule allows these office-based treatment providers to administer or dispense, but not prescribe, the FDA-approved narcotic drug methadone and buprenorphine, the medications used for the treatment of narcotic addictions like opioid use disorder. This allows practitioners who are confronted with a patient experiencing acute withdrawal symptoms to provide relief while arranging for the patient's treatment referral. One important aspect of this rule is because providers cannot prescribe, just dispense, their patients must come back daily to receive their dose with the expectation that an opioid treatment program or an office-based opioid treatment waivered provider will continue care beyond the 3 days. So you can see specific conditions under this 3-day rule exist and they must be met. For more information on this, you can visit the DEA diversion website provided to you on this slide. The Indian Health Services addresses changing attitudes, beliefs, and perceptions to ensure comprehensive, culturally appropriate health services are available and accessible to patients diagnosed with opioid use disorder. Opioid use disorder is a chronic disease, and evidence demonstrates that treatment is effective and recovery is possible. MAT at Indian Health Services facilities is a comprehensive, evidence-based approach to recovery that combines pharmacological interventions with substance abuse counseling, social and holistic services that are supportive of cultural practices and beliefs. When MAT is prescribed at appropriate doses for OUD, it has proven to be safe and effective in relieving withdrawal symptoms and psychological cravings, increasing retention and treatment, decreasing illicit opioid use, and improving patient survival. This slide and the next provide internet links to more in-depth information about opioid use disorder and substance use disorder treatment and recovery within Indian Health Services. The Substance Use Form Line offers an on-demand clinician-to-clinician support for Indian Health Services providers managing alcohol and substance use disorders. You can learn more about this by following the link on the slide. Holistic care refers to healing and wellness for the mind, body, and spirit. It is important to consider cultural, spiritual beliefs and offer resources within the community to meet these needs. You can learn more about this by visiting the link available to you on the slide. Many American Indians and Alaska Native communities experience, cope with, and attempt to recover from the effects of trauma. Data shows that American Indians and Alaska Native people in the United States are at greater risk compared to other groups of experiencing physical, psychological, cultural, and emotional traumas that may result in negative health outcomes. To learn more information about this, please follow the link on the slide. Opioid withdrawal may cause a patient great discomfort and dysphoria and generally will lead the patient to continued use of opioids. If you want to read more about this, you may visit the link that's provided to you on the slide. Also, dysphoria is a state of unease or general dissatisfaction with life. Indian Health Services provides an alcohol and substance abuse program called ASAP. The goal of ASAP is to reduce the incidence and prevalence of alcohol and substance use among American Indians and Alaska Natives to a level at or below the general U.S. population. ASAP strives to meet this goal through implementation of alcohol and substance abuse programs within tribal communities, including emergency treatment, inpatient and outpatient treatment, and rehabilitation services in rural and urban settings. Programs addressing alcohol and substance abuse Programs address alcohol and substance abuse by improving access to behavioral health services through tele-behavioral health methods and providing a comprehensive array of preventative, educational, and treatment services. Currently, more than 50% of the mental health programs and more than 90% of the alcohol and substance abuse programs offered by Indian Health Services are tribally operated. The following slides will provide more information about state-approved treatment providers, inpatient providers, outpatient providers, and opioid federally funded providers. The Montana Department of Public Health and Human Services has created an interactive map that provides the location of state-approved inpatient providers, outpatient providers, and opioid federally funded providers. By clicking on the appropriate tabs across the page, you can locate these different providers across Montana. Please note that the colors that you see on the map do not represent any significant information. It's just a visual way to distinguish between the counties. But as you can see, the blue dots represent all the providers that are available throughout the state of Montana. The Montana Department of Public Health and Human Services Addictive and Mental Disorders Division strives to implement and improve an appropriate statewide system of prevention, treatment, care, and rehabilitation for Montanans with mental disorders or addictions to drugs or alcohol. AMDD provides substance abuse and adult mental health services by contracting with behavioral health providers throughout Montana. The Montana Department of Public Health and Human Services has created a web page that houses an array of information and resources pertaining to COVID-19 and mental health and substance use disorders. At the individual level, this website addresses behavioral health, stress, treatment and recovery support groups. For the family level, this website provides parenting, developing children, trauma, grandparents, kids, teens, and self-care information and resources. And for providers, this website provides financial support options, telehealth information, behavioral health information on people with disabilities, and treatment of opioid use disorder. In addition to the information listed here on this slide, other resources provided on this webpage include the Montana Crisis and Emergency Resource Guide, the Montana Crisis Recovery Find Help Guide, and the Montana Suicide Prevention Lifeline, as well as the Crisis Text Line. To check out this website, please follow the link that is shown on the slide. Poor mental health affects thousands of Montanans. 1 in 10 Montana adults, which is nearly 84,000, report frequent mental distress with 14 or more days of poor mental or emotional health in the past month. Suicide, a mental health crisis, continues to affect every Montana community. Suicide-related deaths in Montana are 2 times higher than in the United States. From 2011 to 2015, an average of 240 suicide deaths occurred each year in Montana. The Montana Department of Health and Human Services continues to address the mental health needs of Montanans. According to the 2019 Montana Youth Risk Behavior Survey, 37% of students felt so sad or hopeless almost every day for 2 weeks or more in a row that they stopped doing usual activities. Please visit the links provided to you on the slide for more information on mental health services in Montana. This slide continues to provide you with links to mental health services. Links include County Mental Health Resource Guides, Mental Health Services Bureau programs and contacts, Montana chapter of the National Alliance on Mental Illness, MSU Extension Health and Wellness, and Tribal Indian Health Services, Mental Health Services and Resources. This concludes Module 4. For more information on prescription opioid use and misuse in Montana, you can visit our project website. Our website will allow you to access the other 4 modules and their PowerPoint presentations, the Native American Toolkit, and several informational and recovery story videos. You can also print and/or download our educational resources and order a medication disposal pouch while supplies last. If you have any questions, or if you know of an organization that would benefit from this toolkit or would like to present the toolkit to their communities, please email our Program Director, Barbara Allen. You can also visit the Montana Department of Public Health and Human Services website at the link provided to you on the slide. Thank you for listening today, and we hope that you have gained knowledge and awareness on the topic of prescription opioid use and misuse and the resources that you can find across the state of Montana.